Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. All right, welcome back, everybody. We're so excited here with Heather Lucas and Dr. Mark Holthouse. Peptides. It's all the rage, right? We've talked a lot about peptides on this podcast before and our social media channels, but we're so excited because I feel like it's like weekly now. We hear about a new up and coming peptide or new data on a peptide that we've been using for a long time. So I feel like this could just be a continual, part 1, part 2, part 3, part 4, and just kind of updates on peptides and what we're doing here at FMI to help people optimize their health and feel their best. So I'd love to start with what I think is a really great tool we have in our toolbox, but also a very controversial peptide, and that's these GLP-1 GIPs, the weight loss peptide. And I know both of you are going to have a lot to say, but Dr. Holthouse, do you want to start on kind of the data that we're seeing and that is emerging on these infamous type of peptides?
What you said is so true. It came out initially as a diabetic drug years ago, some of these things, and the earlier iterations of these weren't near as good as the newer ones are at weight loss.
Right.
And that's when it really took off, right? When we found, wow, you can have a 20% of your body lose that much weight. We've had nothing like that. Up to now, we've had things 5%, maybe 10% of your body weight with diet medications. And those things were fraught with many side effects. They were contraindicated for people with blood pressure and heart disease and all kinds of problems. And so now we have kind of this repurposed diabetic category that has found its way into metabolic medicine. So I'm having this love affair with GLP-1 GIPs, which is the family name for some very common things you've heard about from your neighbors and even from your local pharmacists. And due to some of the changes and things that have come about, we call them now by their chemical names, their medical names, as opposed to trade names, just to stay out of hot water. But what's so exciting, I think, for us as a clinic is to find out that these things are not only wonderful for things like weight loss and controlling insulin and sugar, but now we're seeing benefits with things like potentially removing fatty liver. And if you understand where in the cell, how they're working, it all makes sense. It's supporting a balance at the cell level of oxidative stress and supporting our oxidative systems that, the mitochondria is this little motor inside the cell. And just like your motor in your car, a lot of combustion, there's a lot of things. It's a messy process, and 90+% of the reactive oxygen species that come and reactive nitrogen species that come from our bodies are made in this mitochondrial motor. And so there's a lot of potential damage to DNA and to fats and to other macromolecules that can happen with this stuff around. So knowing that we've got these products that help support that balance, besides just telling people to take, glutathione and vitamin C and vitamin E and antioxidants is pretty special. And then you see the applications because of its inner workings at the cell level being protective, preventing cells from aging, becoming what we call senescent. Checking out, they're not dividing, but they're not dying either. They're just kind of hanging around like somebody that needs to just go home. They've overstayed their welcome. And they're secreting inflammatory cytokines and chemokines and all of these things that make us feel bad and age prematurely. So you have these kinds of substances now that are not just performing these miraculous things with things like fatty liver, glucose, weight loss. We're seeing it drop intraocular eye pressure. We're seeing it with neuroprotective effects in the brain, in the neurons, cardiovascular protective effects in the heart cells, cardiomyocytes, in the kidney cells. We're seeing their renal protective effects. In addition to some of this stuff that's going on with anti-aging. when you look at what parts of the cell are being activated, this autophagy, the idea of recycling old, worn out cell parts and misfolded proteins that are the result of metabolism and stress, you realize that it's got longevity and anti-aging qualities. As part of that same pathway, it's promoting fat burning, not just weight loss. It's actually promoting a lack of obesity. So when we talk about weight loss, we're more concerned about body composition,
right,
as opposed to the scale being lighter. We want to see percent lean going up and percent body fat going down. And so these things are aimed squarely at cell efficiency. That's the term that we're all using, that we're trained to use. It makes your cells work better. They're more efficient. They hang around in a healthy, contributing form for a much longer period of time. And they tend not to become these zombie senescent cells that we've now identified with premature aging. So pretty cool as a class.
Are you concerned about the dose? Are you concerned about people buying this online from China, from Canada, from Mexico, from anywhere online? Like what are some of your concerns around that?
Yeah. One of the biggest drawbacks to this class of medication is cost.
Right.
And the problem with getting these things from non-reputable, non-vetted sources like the online things, especially from Asia and other places like that. And I just cringed today. I was meeting with a woman, and her son-in-law was getting them from China. And, just online.
Yeah, yikes.
And the problem is we now know, because these are cell messaging molecules, they give marching orders to your cell, to the genes, to the enzymes, to everything that actually allows our bodies at a cellular level to function correctly. You need 99% purity.
Right.
95, 96% is unacceptable. Those impurities are giving cell messages. We have no idea what is being
Yeah, it's not like it's a lack of efficacy. It's actually potentially a toxicity and an unwanted side effect.
Yeah. Right. So not working,
right,
number one, or worse than that, causing unwanted side effects.
Right.
Exactly.
Yeah.
And so wherever you get them, you've got to make sure that it's a vetted source with a medical professional that knows peptide medicine.
Yeah. And knows how to dose it and the other things that go along with it, and how to educate you appropriately so that you, like you said, appropriately fine tune your body composition.
I think one of the things that we have kind of discovered just over the last couple of years using these particular products is that they have side effects, nausea, and some GI side effects that can largely be avoided with what we call microdosing, where we're starting with non-traditional milligram strengths as the initial dose. And the other strategies to avoid things like nausea is taking that total daily dose, dividing it up into 2 injections over the week instead of all at one time. So the total weekly dose is unchanged, but they're spreading it out. So their tolerance is better.
Right. Tolerance is better. And then also doing the smaller doses provides more of a gradual weight loss, which is a safer, healthier way to lose weight in the face of trying to preserve as much lean muscle mass while losing the fat. We lose weight rapidly. Chances of us burning up our muscle, which is so important to hold on to, especially as we age, the risks increase.
And by the way, rapid weight loss, that what you just mentioned being muscle mass loss, that happens with or without this category of peptides, right? Someone goes on a binge diet or a water fast or loses 50 pounds, that statistic remains the same, whether it's being utilized with these GLP-1 GIPs or any type of weight loss peptide versus just true weight loss. So I think that's an important statistic that most people don't fully recognize.
Yeah. Slow and steady wins the race.
Totally.
In weight loss.
Totally.
Sure.
Yeah. Yeah. No, I love it. My clients, and that's why I love microdosing, because one of the first things they say is, I even had a client last week who said, I feel more energized and I feel like I've lost that initial layer of inflammation. And that was just always such a cool thing to hear. That's what we're trying to do, right? We're always trying to decrease inflammation.
Yeah. Anecdotally, just speaking from patient experience or client experience, I'm hearing an improvement in brain fog.
Yep.
I'm hearing that they sleep better, they have more energy, and they're motivated to go exercise. So those are huge wins.
Yeah, absolutely.
Of using the peptide.
Yeah. Yeah, that's huge.
When it first came out, you heard a lot of trainers and a lot of backlash about, oh, this medication actually causes a loss of lean muscle mass.
Yeah.
In fact, losing weight with a diet strategy, the studies are showing that there's more muscle loss doing it that way than using these medications. So it's not the medication, it's the rapid weight loss.
Right. It's again the dose.
It's in the dose.
Yeah.
And it's virtually impossible to not lose any muscle mass whatsoever when you're losing weight. That's just normal with any way you go about it. Right. I think with using the higher proteins, the adequate amount of resistance training, and microdosing, it's really kind of the trifecta of low side effects, efficacy, and maintaining as much lean muscle mass. And we use these BIA machines instead of scales. So we actually have a metric to compare baseline and every month or two as they go. You can see their, a lot of times they plateau on their weight loss, but they're still losing fat and gaining lean. And so the weight becomes so irrelevant at some point.
And as soon as you educate them on that, that's so empowering for the client who's so frustrated by the scale. Wait. Hold on.
Are your clothes
Let's pull back.
better?
Let's look at your BIA. Yeah. Are your clothes fitting better? How are you feeling? Let's pull out your medical symptom questionnaire 4 months ago. And I want to remind you what those numbers were compared to today. So yeah, you do have to kind of pull that emotional client back when they do plateau and kind of re-educate.
Yeah. And Dr. Holthouse, you hit on what I refer to as my non-negotiables. If somebody is a candidate for this peptide and they're ready to pull the trigger and get on it, non-negotiables, you must be doing resistance training 3 to 4 days a week minimum. You really need to be stimulating your muscles so that you're not targeting your muscles for fuel as you're in a calorie restriction. Right. And the other non-negotiable is your protein intake. You've got to be eating a gram of protein per pound of ideal body weight is kind of the metric that I use.
Now, I know you, Dr. Holthouse, particularly are you two are, Heather, because you're just a peptide freak yourself. But you guys are very excited about this new non-FDA approved peptide in the similar class that's a triple agonist, right? Yes. That's up and coming, and we're seeing some pretty exciting data stemming from that. Can you introduce that a little bit?
Yeah. So we have these 3 receptors that we're trying to hit. And, the originals came out hitting the GLP-1 receptor. The next iteration added the GIP, glucose insulinogenic peptide or something like GIP. The idea meaning that they don't respond unless you have glucose coming down from eating a meal into the GI system. And that's what triggers the release of insulin from the beta cell of the pancreas. Now this third one has a glucagon receptor, which is another controller of all of these things. It's another receptor that's being hit. So instead of 10% body weight loss or 20% body weight loss, now we're looking at upwards of 30% body weight loss. So, you have to understand historically, up to this point, the best medications we had for weight loss might hit 10%. On a good day.
So this is significant.
So this is triple what we've ever seen, and with it so much less in the way of side effects.
Right.
The number of people that are contraindicated, it's far lower than using something with Ventermine or Topamax, topiramate, kinds of medications. So pretty exciting stuff.
Yeah, no, it's awesome. Very cool. Well, we didn't just film tonight because we wanted to talk about GLP-1s and GIPs. I promise we have other things we wanted to discuss too. I know you're really excited about a new peptide that we have access to, SLU-PP-332. Yeah. That's a long name, but could you introduce and give us some tidbits on that one?
Yeah, this is an exciting one for a couple of different reasons. So many people are on the GLP-GIP bandwagon and thinking about using that peptide for weight loss. But what if you're someone who just has a few pounds that you're looking to lose? 10 to 15, 20, we'll call them vanity pounds. You're just trying to improve your body composition a little bit. Or maybe you're someone who doesn't like the idea of injecting yourself with a needle a couple times a week. There is a new compound. It's actually not a peptide, but it's talked about a lot in the peptide world because it can be stacked with peptides or it can be used independently. And this is an oral small molecule compound that's gaining a lot of attention for its potential role in performance support and metabolic health. So this is called SLU-PP-332. So if you're interested in burning fat more efficiently, supporting your mitochondria, or taking your workouts to the next level, this could be one that you might consider.
Is it oral?
It is oral. Yeah, it's a chemical building block rather than amino acid, and it's often used alongside other peptide therapies because it works through different pathways, making it a great add-on for boosting metabolism, energy, or weight loss. It helps. The way that it works is it helps to upregulate pathways involved in mitochondrial biogenesis, fatty acid oxidation, and thermogenesis, the body's natural process of producing heat and burning calories. So think of it as flipping a switch, a metabolic switch that enhances your ability to use fat as fuel, improves your endurance, and supports overall mitochondrial health.
So is it an exercise mimetic? It could be considered that, right? Based on what it does. Yeah,
mimetic,
for sure.
Exactly. Okay. So it just helps kind of rev up your body's metabolism.
Is it really expensive?
It's not really
Okay. I was thinking, ooh, I can't wait to hear the price tag on this guy.
It's really not. It's really,
okay.
I would call it kind of like an entry level.
Okay.
A nice alternative to the GLP-GIPs for losing weight, enhancing metabolic function, your mitochondrial biogenesis, and fat oxidation to burn more fat.
Which means making more mitochondria.
For sure.
Which is a good thing. You know, the more the better.
Yeah.
Right.
Okay, cool. Wow.
Most people who use the SLU-PP-332 describe it as subtle but noticeable boost in clean energy. So not like not a stimulant like caffeine.
Yeah. Okay.
But at higher doses, it can cause mild nervous system, like jitteriness or restlessness, similar to how you might feel after a strong cup of coffee.
And it's dosed every day. It's a daily dose.
Yeah. So because you can have that jitteriness, we start low and go slow, as it's kind of our mantra here in functional medicine with all things. And timing matters too. So it's ideal to take it before a fasted cardio session.
That makes sense.
Like your morning walk or workout, because your insulin levels are lower at that time, and that enhances the fat burning effects. Some people prefer to split their doses, taking half of it in the morning and half again in the early afternoon for that sustained energy benefit, similar to caffeine. It's best to cycle it, used for 2 to 3 weeks at a time, and then take a 1 to 2 week break. This helps avoid receptor desensitization, so that your body keeps working the way that it's supposed to, and then also it makes the compound or the SLU-PP more effective because you're not building up a resistance to it.
Okay, cool.
So stacking it, one of the exciting things about this particular molecule is that you can stack it with things like L-carnitine or berberine, or even use it in addition to one of the GLP receptor agonists to enhance fat oxidation and mitochondrial efficiency. And then, of course, that said, you'll get the best results when you use it alongside a whole foods diet, resistance training, and consistent movement. So it's not a magic pill. It's not just going to burn fat for you. You've got to do a little bit of the work too. It's not a quick fix or substitute for the healthy habits.
Cool.
It's generally well tolerated. However, it's not suitable for everyone. So if you've had a history of like a heart attack, or you have high blood pressure, arrhythmias, any other cardiovascular disease.
Probably history of stroke, TIA, probably contraindicated.
Yeah. You'll definitely want to be cleared by your healthcare provider before using.
Don't go buy this from China, please.
Product. Yeah, don't go buy it from China. But work with someone who knows what they're doing. So big picture benefits to summarize. SLU-PP-332 offers a promising new way to support fat loss, improve endurance, boost energy and cognitive clarity, and support your mitochondrial disorders or metabolic sluggishness.
So cool. So that might be a really good segue into Mots-c. Talking about Mots-c as improving mitochondrial biogenesis. It almost makes me think that it's like a more mild, and again, like you were kind of saying, maybe someone that doesn't want to inject.
Yeah, someone
Like
who wants
Mots-c.
an oral route, doesn't want to inject, or somebody who just has a few pounds that they're trying to lose, not necessarily wanting to go on one of the GLP, GIPs, or for whatever reason. It's just a different option to help with body composition.
Have you had
mitochondrial support?
Okay, great. Have you been using Mots-c a lot, Dr. Holthouse, in your practice? Okay.
Once in a while, it's when I have somebody that's battling obesity and pre-diabetes, metabolic syndrome is kind of the group. The two I like to use is the one we're going to talk about a little later, the 5-amino 1-MQ, which is actually not a peptide either, but it's supportive. And there's definitely synergy with like a Mots-c that's going to really anchor your weight loss and your fat loss.
Right.
We look at a lot of these things and there's some unifying themes that we'll probably try to summarize at the end with regards to cellular aging, promoting fat burning, lysis means you're burning. Beta oxidation, fatty acid beta oxidation is burning fat for energy. The glycolysis and the Krebs cycle and the electron transport chain, these are all mitochondrial terms that are dealing with burning glucose and burning fatty acids. And these things kind of all have that theme.
Right.
Literally everything we're going to be talking about tonight, a lot of them deal with obesity, deal with insulin signaling, deal with antioxidant support at all cell levels. So it's not a surprise when you hear that the neurons do better, your memory's better, your muscle cells work better, because they're activating a lot of the same pathways. This AMP kinase, which we're dancing all around that pathway. And I was going to ask you if they know what paths that one's using. It almost sounds like it's an AMP kinase pathway. I don't know if they know or not yet.
I've had luck with using Mots-c, which again, I didn't do a very good introduction of it, but it does what this oral molecule that Heather was talking about, improving mitochondrial health. To be honest, some of my mold clients, just the brain fog and the chronic fatigue these clients are dealing with, right? Because a lot of these clients, you have to get them to a state where they're motivated to even be able to start the healthy eating plan and the detox support that they need to detox the mold. And so I've had really good luck using Mots-c to kind of kickstart them and like wake up their mitochondria, because they've been so damaged from mold and probably chronic viruses and trauma and nervous system. And so I have found that peptide, although it is a little bit more on the expensive side, but that's kind of why I was thinking like, gosh, the one you're talking about almost sounds like just a more mild way to help some of these
one of the reasons I probably want to share why
Yeah.
so much of these peptides and these supporting compounds that go after supporting the mitochondria, why is that such an important goal?
Right. Good point.
These tissue types that are highly metabolically demanding of energy, they need a lot of ATP.
Yep.
Your neurons, your ability to have focused, sustained attention, your muscle cells, your heart muscle, these are highly metabolically active cells. You could even argue the cells that line the GI tract, they're turning over every 72 hours. These are highly, highly metabolically active cells.
Our brain cells too, yeah.
Right? So you think
Cardiovascular.
about people that have mitochondrial failure or dysfunctions, we call them mitochondriopathies. How do they manifest? They manifest as general weakness and brain fog.
Fatigue.
Yeah. And these are all the highly ATP mitochondrial, because that's where you make ATP, dependent tissue types.
That's such a
so
good...
it kind of makes sense.
It totally makes sense. And how we're looking to help these people. Yeah. Wonderful. Let's, well, I think you already mentioned it and we're already kind of on that topic. So let's go ahead and talk about the 5-amino 1-MQ.
Oh, sure.
I think we should.
So 5-amino 1-MQ is something I'm just, again, I'm a two-timer because I'm falling in love with this one now a little bit too. Again, it's not a peptide, but this is something that can come alongside a foundational therapeutic lifestyle with good cardio hit, with good resistance training, good clean food, managing stress and getting good sleep. if you are a lot of people ask me, hey, do I need NAD? Which really, you have to talk about NAD if you talk about 5-amino-1-MQ. What this stuff does is it directly inhibits one of the enzymes that basically breaks down NAD from being actively cycled in the cell. NAD, oh my goodness, you guys, we'll have to do a triple discussion to get through what all it does. But
Yeah.
From 10,000 feet, it's basically in the context here, it's used in glycolysis, the process of taking glucose and entering it into the mitochondria, getting energy from it, making ATP and in the Krebs cycle, and then eventually transporting electrons around to make it. NAD is a vitamin B3 derivative, and it's absolutely necessary for energy. It has a huge role in what we call redox, or the oxidative reduction balance in the cell of oxidative stress, cellular aging, autophagy, mitochondrial biogenesis, making new mitochondria, mitophagy, which is destroying and checking out old mitochondria that have overstayed their welcome. So if we can keep NAD around, this is kind of the holy grail.
Yeah.
And kind of version 1.0 was, hey, let's just give everyone NAD, either an IV or an injection, or we give them nicotinamide mononucleotide, NMN, or nicotinamide riboside, these precursors that are one of the ways that you can make NAD. You can also make it what we call de novo from tryptophan or from nicotinic acid. So the cell has all these different ways of making it, but most of it comes from being salvaged. It's used as a cofactor for a bunch of different cell processes. And that's why it has such a broad implication of use. What we don't want is we don't want to metabolize it away. And 5-amino-1-MQ basically inhibits the nicotinamide N-methyltransferase, geek out a little bit here, enzyme that checks it out. It methylates it and it takes it out of the cycle, the active NAD pool. NAD gets broken down into something called nicotinamide, NAM, which gets recycled through what we call a salvage pathway. And so if you can inhibit it from getting broken down and taking out of this pathway, you've gone a long ways to improving NAD levels in your cell. And why does that matter? We used to think that NAD, we just needed to give more.
Right.
As we age, we know it drops in the cell, the levels. And what we're learning is that it's dropping because the enzymes that break it down are upregulated as you age. So you don't want to just focus on production and giving. You can use enzymes and things like this 5-amino-1-MQ to prevent it from being broken down, and keeping it in the cell as you age is probably a more efficient way to maintain levels. Apigenin, which is from parsley, it's a bioflavonoid. It's a supplement as well, is known to inhibit this other enzyme called CD38 that breaks it down. So if you're doing a little bunch of parsley in your protein and you're doing some 5-amino-1-MQ, you can really do a lot besides just taking NAD precursors.
And this is oral, and you take it every day.
Yep.
And it's not, from what I recall, it's not crazy expensive.
Not crazy expensive.
Yeah, it was pretty reasonable.
Exactly.
Yeah.
I think it can be oral or injectable.
Really? Oh, I didn't know it was injectable as well.
I think you're right. I have to look.
Oh, cool. Yeah. Okay.
And this compound was originally studied in metabolic research, looking at ways to improve insulin sensitivity and reduce fat accumulation, specifically visceral fat. Visceral fat is?
Visceral fat is the inflammatory fat that drives everything bad. Fatty liver, diabetes, we think probably dementias and all kinds of things, heart disease. But there you are again. I mean, the GLP-1s, GIPs. We're going to talk about the growth hormone group, 5-amino-1-MQ. They're all promoting this cellular environment of burning fatty acids, beta oxidation, and burning glucose. And so, better body composition,
Right.
better visceral fat levels.
And I read a study that there was a 30% reduction in cholesterol using 5-amino-NMQ.
30%?
30%.
That's pretty impressive. That makes sense because it's going to affect your lipid balance in the cell.
Step aside statins. We have a new kid on the block.
Oh, yeah.
New kid on the block.
Yeah, metabolic syndrome, obesity are some of its earliest indications. And I'm just digging it for an NAD. NAD is one of its primary roles in sirtuin and AMP kinase, that whole pathway is to improve obesity, improve lipid profiles, improve redox, again, energy.
So you have all your weight loss clients on this compound?
I don't have them.
You're getting there, but you're getting there.
We have kind of the GLP-1, GIP phase 1.
Right.
And then we're kind of moving people down the line to, hey, it's not so much now about weight loss. Now it's about all these other cellular benefits.
It's about cellular efficiency
that I want.
At that point.
Yeah, anti-aging.
For sure.
And so we're moving them toward the growth hormone secretagogues, and we're moving them towards things like this.
Yeah. Okay, growth hormone secretagogues. This is my probably favorite class of peptides just because of all that they can do.
Yeah. Yeah. Oh, I can start the ball, but y'all got to
If you can. Okay, that'd be great.
Okay, so to set the stage, there's been HGH, human growth hormone, that some folks have given. It's historically been given by pediatric endocrinologists for kids that are short stature, that aren't growing properly. The problem with giving growth hormone like that is that it's been associated with growing certain cancers and promoting things like diabetes. It also shuts down the natural negative feedback loop between IGF-1 and the hypothalamus and the pituitary in the brain, which is where you're making growth hormone. So what is brilliant about these peptides is that they're mimicking growth hormone releasing hormone that's made in your hypothalamus neurons naturally, and it's secreted right after you fall asleep in stage 4 delta sleep, that real deep sleep that your Oura Ring shows you go into when you're watching those architectures. And that's the first sleep that you get, really, really deep. And you go through several cycles of that through the night. But this is normally when your hypothalamus, the master gland controlling your pituitary that then releases growth hormone, is doing its thing during that deep sleep at night. So what these peptides are doing, growth hormone releasing hormones.
Why do we care about growth hormone?
Why we care about growth hormone is because, like things like testosterone, they're tissue regenerating. They're involved with taking out the trash in the brain, detox, what we call the glymphatic system that's happening. It's involved with restoring natural deep sleep, which is the sleep we lose as we age.
Right.
So it's not only being secreted during that form of sleep, but it helps restore the very sleep that we're losing as we age.
And we start losing growth hormone in our 30s. It's not like our 60s. It starts to go down 15% each decade starting in our 30s. So this is something that, sorry, 30-somethings, you're not young anymore. I'm just joking, but it is pretty... The more we learn about longevity and anti-aging and cellular efficiency type of medicine, the more you do learn like, oh, wow, 50 is the new, it's just because you have to start really thinking in your 30s and 40s about what you want your metabolic health to look like in your 60s and 70s. You have to be proactive now.
Yeah, to have those results then.
Yeah, for sure. Yeah. Anyway, sorry. Okay, so
no, I wish I'd have known
more about growth hormone, why we care about it, why we should be paying attention to it.
And it keeps us thin. It basically promotes protein synthesis and muscle growth while it causes this fat loss that she was referring to in the product she was just mentioning. Very similarly, so it's a body composition maintainer. It's involved with avoiding things like bone loss, osteopenia, osteoporosis. It's involved also with neuroprotection in the brain, the gut.
Collagen production.
Collagen, absolutely. So there's a bunch of reasons why we should care about growth hormone. And now we've got these products that are natural mimics of what the body's used to seeing that it makes already. So growth hormone releasing hormone comes from the hypothalamus, and it kind of sets the stage of telling the pituitary, hey, you need to make more growth hormone. So we also combine with something called a growth hormone releasing peptide. This gets a little confusing, but just think of both of these kind of working in tandem. One of them is setting up the supply and the transcription. The other one's a secretagogue, which is helping release it in a pulsed dose, also deep sleep at night from the pituitary itself. It also, as a group, helps release growth hormone releasing hormone from the hypothalamus in addition to growth hormone from the pituitary. So it has a dual synergism with the growth hormone releasing hormone. So CJC 1295, ipamorelin, that's an example of one of those duos that does that. There are some that are so strong that you don't need to use them, tesamorelin, in a combo. They work pretty well by themselves. But this family is really more about promoting all those benefits of growth hormone, which is cellular redox, anti-aging, autophagy, detox, immune modulating, anti-inflammatory, brain fog, cardiovascular, GI, renal benefits, to say nothing of muscle and body composition and insulin regulation. These are as important, I think, as many of the peptides that we use at helping with prediabetes, metabolic syndrome, and dyslipidemia, cholesterol.
Right.
These are all diseases that come from mismanaged glucose and insulin signaling at the cell level. So when you combine exercise, strength training, and high intensity interval training, where you're teaching your muscle to be sensitive to insulin, and you're optimizing the products in your brain that naturally are secreted at night, like testosterone, especially in men, and in both genders with growth hormone, to burn fat and use insulin more effectively. Oh my gosh. The limits, it's unlimited.
I agree.
And what this is...
It has its caveats, though. We do have to be careful.
Yeah, you have to be careful with that. Unlike growth hormone, you're not going to desensitize downstream receptors. You're not going to cause those cancers and the diabetes issues. We watch downstream things like IGF-1 made by the liver in response to growth hormone as a marker, but these products don't usually raise that. So you know you're not harming the natural feedback and rhythm, which is what I like about that and why I never used growth hormone. It's a bit by itself. As a product.
Gosh, you too. I feel like you guys have been paid by the makers of these peptides to speak about them. You're just speaking about them so brilliantly and passionately and eloquently. And these guys do not receive feedback from these companies, by the way. The makers of these peptides.
We're just excited about them. We use them ourselves. We use them in our friends and family.
Such great resources.
And in our clients.
So good. Anything, did you want to speak about some of these growth hormone analogs at all? I know you love CJC and ipamorelin just as much as the rest of us.
I do.
Yeah.
I do. I'm flooded with all the newer peptide and blends that are coming out and just drinking out of a fire hose to keep up with all of them.
Everything,
It's interesting how so many of them will kind of promote or function in a lot of the same ways. But I think, like Dr. Holthouse was just mentioning, because they target things at the cellular level to improve our cellular efficiency that drives obesity, that drives inflammation, that drives aging, all of those things. And these peptides just really hit the cellular level and improve mitochondrial function and just getting our bodies to function like they did in our youthful years. And so they really do have a wide breadth of targets and things that they can help.
I think peptides are one of the greatest tools of modern medicine. Like, I really do.
A common question we all probably get is, am I committed to having to do something like this the rest of my life?
Good point.
Great point.
And I think that we want to come off as these are bridges, these are tools that are, you're not going to have the side effect profiles like you will with new to nature molecules in typical pharma.
Yeah.
Where the body's never seen what that is before. And those block enzymes and they poison enzymes and block receptors, as Dr. May says. These are actually coming alongside and doing the job that the things our bodies are already making in a way that's better and at a time when we were younger to avoid the diseases that are killing us, which are heart diseases, stroke, dementias, insulin resistance and diabetes and cancer. So it's going after what Peter Attia calls the 4 horsemen in his book, Outlive. It's really what anti-aging is. So we see these things kind of like we do supplements, where if they can be used as a safe alternative to medicines which really don't address the root cause and are keeping the pharmaceutical companies very wealthy because they're forever drugs, for a period of time, and to buy time until we get the therapeutic lifestyle, the sleep, the stress, the cortisol, the exercise dialed, the hormones dialed. My intent is to get people off of, these are short, they're cycled. So just so nobody gets the wrong idea, we're not promoting like these are something you need to be on the rest of your life.
Right. Cycles.
You said it so well. I feel like, anti-aging, longevity, that whole era started as just kind of aesthetics, right? And almost like the superficial aspect of it. But this is so much deeper than that. This is truly, and you just said it so well and so eloquently, like this is really internally trying to turn back time and fix the diseases that we see as we age. And it truly has become root cause medicine in that respect. So that's just, so amazing.
Well, I think about the diseases of aging that are now directly tied to oxidative stress.
Right.
Cataracts. Those are advanced glycation end products in our lens.
Right.
Ages, we call them. Things like macular degeneration. What are the ophthalmologists recommending? AREDS. That product, AREDS 2. It's lutein, it's zeaxanthin. They're antioxidants. So, and there's many cancers associated with inflammatory diseases like diabetes. So if we can go at a root cause as to where these things have become uncoupled in the first place, we're dealing with cleaning up the cell, making it work better, dealing with inflammation.
Well, and what you just mentioned, that's why they're starting to use these GLP-GIPs in anti-cancer research for that reason. So it's pretty astounding. You start to think about obesity, metabolic medicine, and the new tools we have in our toolbox for that.
Yeah.
So much bigger than just losing weight.
You're almost saying like these peptides are a root cause approach.
I mean, goodness.
Well, I think
they sure can be.
I think that's why we've embraced it, even though they're pharmaceutical category. These are not new to nature molecules that are just blocking enzymes and poisoning, receptors and whatnot. These are actually innate, addressing the pathways that have become dysfunctional for whatever reason, genetically,
multifactorial,
epigenetically from your environmental exposures, what have you, and getting people back to functioning cells. It's kind of like the idea of using stem cells and exosomes and some of these things where people are chasing the early unadulterated version of themselves without having to do that, using their own cells and making their own cells healthier.
Right. And I feel like as opposed to the IV exosomes or stem cell approach, which can be still a good approach, it actually is a little bit more personalized finite medicine, I think, because we are now knowing that we can target very specific pathways with these peptides. So it's precision medicine.
Yes.
Which we've been saying is like the new functional anti-aging term, right? Precision medicine. And that's exactly what we just spent the last 45 minutes talking about.
So now you've just set yourself up for the next podcast on regenerative protein arrays.
Okay, here we go. That's a little saver for later. I love it.
Little carrot.
Yeah, just dangle it. That's so awesome. Mic drop. all the above. There's not much more we can say. You guys did such a fabulous job. Thank you so much for your time tonight. And definitely more to come on this topic. We could probably create 6 more episodes based on a number of subjects we just discussed. And we will plan on doing that.
And all the skin collagen stuff.
Yeah. Well, and I think next up, probably NAD. You also dangled that carrot too. Yeah. Let's just dive into NAD and all that it can do for us. So yeah, thank you so much, you guys. And come see us at the FMI Center for Optimal Health and for access to these type of peptides, compounds, and more. So much more to come. Thank you so much. Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available so you can trust that you're giving the body the support it needs. Visit FunMedShop.com today and take the next step in your health journey. That's funmedshop.com. Thank you for listening to the Functional Medicine Foundations podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.